Welcome to today's webcast. Before we begin, let's quickly go over how to get the most out of this session. Your main player area consists of 3 windows: video, slides, and a multi-function window underneath. Each of these windows can be moved, resized, maximized, or even closed. If you'd like to return to the default layout, simply click the Restore button on the left-hand side of your screen. The multi-function window is where you'll find some helpful tabs like Questions and Answers, an area to download any available materials, and speaker bios. KPMG has been approved by NASBA to deliver CPE-worthy training. Today's CPE will be tracking your participation through attendee checkpoints, which will look like this. In addition to attending the entire session, you must confirm your participation by clicking Confirm each time this message pops up. Your participation will be tracked, and failure to actively participate will result in denial of CPE credits. If you have any technical issues during the webcast, please submit a question through the Questions and Answers panel, and our producers will respond to you directly. Please submit all content questions through the Questions and Answers panel as well. Thank you, and enjoy the webcast.
Welcome to Day 2 of KPMG's 2023 Global Life Sciences Summit. My name is Anna Marie Detert, and I'm a partner in our Healthcare and Life Sciences Strategy practice based in London. We also have Guillaume Favier with us, who will introduce himself and walk us through a few logistics for the event.
Thanks, Anna Marie. My name is Guillaume Favier, and I'm a partner within our Healthcare and Life Sciences Strategy practice, also based out of London. For our guests who are joining us to gain CPE credits, please do remain logged in for the duration of today's program, and feel free to reference to the instructions on your tab Media Player for more details about securing those credits. At any point, please feel free to use the Q&A button to ask your questions, and also reach out to our technical staff in case of need. Today, our focus shifts to the themes of technology, connected enterprise, and finally, the future of life sciences. All those topics are equally exciting, and I look forward to hearing from our experts and clients.
We're going to begin Day 2 with Data as an Asset, where we are delighted to have our distinguished guest speakers. Rachel Lin, Regional Commercial Director, Janssen Asia Pacific; Freddie Yu, Director and Data Scientist, Janssen Asia Pacific; and Thomas Halliday, Life Science and Healthcare Customer Vertical Leader from Clarivate.
Anastasia Miros, a great data expert and a director in our Healthcare and Life Sciences team, will be joining us from our offices in Singapore to share with us great insights on how data can enable competitive differentiation and strategic advantage for life sciences companies.
Hi, I'm Anna Miros, and welcome to our session today on data as an asset. We're witnessing a new era of big healthcare data and seeing stakeholders across the ecosystem recognizing and leveraging its value. Patients now demanding individualized data-driven care and relationships within and beyond the healthcare ecosystem now traded on data. In this session today, we'll dive into this topic where, just as we're seeing patient centricity evolve healthcare models and systems, we're seeing the same with data. Today, I have the pleasure of being joined by Rachel and Freddie from Janssen and Thomas from Clarivate to share their perspectives on the topic.
Thank you, Anna. So first of all, my name is Rachel. I'm the Director of Bladder Cancer Commercial in Asia Pacific. My interest in data, or especially big data, is the ability for us to leverage it to find patterns and insights, leading to other possibilities to address unmet needs, people healthier, and address unmet needs. And if we can leverage data science to help us derive more insights, more precise insights, imagine what we can do.
I'm Freddie, so the Director of Data Science in Janssen Asia Pacific. So I'm working closely with Rachel. So working in the field of data science, so I mean, it's always that a data scientist wants to push for the boundaries of an innovation. So, but at the same time, we always have the problem, how do we get high quality data to deliver the insights? So I'm quite eager to learn that from the different healthcare players, how we really look at the data and the ways they're driving these changes. So that will decide really how far we can go in terms of the innovation and really better deliver the insights to our patients.
Hi, I'm Tom Halliday. I head up the commercial operations for Clarivate's LifeScience and Healthcare division. We serve many different pharma, biotech, and medical device companies, payers, and providers across the globe. And data is, as Anna said, is a huge topic, and it's been a topic for a number of years. But we were recently we were sent a bank analyst report that actually quoted around 30% of all data generated across the globe is actually healthcare related. So you can just think the amount of data that's being produced every single day about patients through wearables, through medical claims records or electronic health records. It's incredible. And that volume of data requires data scientists like Freddie and the colleagues I have here at Clarivate to really try and create value from all that data to ensure that we're doing the very best we possibly can for patients.
Thanks, Thomas, and thanks, Freddie and Rachel. And I love the passion about data. Who'd think we'd see the day? So adding to that, I mean, you each come from different perspectives, both technically from business, data science, but as well across the industry ecosystem, industry and provider side. I'm interested, for your respective businesses, where do you see yourself fitting in this data ecosystem? What have you really been doing in terms of leveraging data in the last 5 years?
So I think from a Janssen perspective, especially in Asia Pacific, it's really about last 5 years or last few years, we are truly evolving into a more data-driven organization, right? To do that, first of all, our investment went into finding and building new data sources, and also to enhance our internal capabilities. That's the people, the process, and the systems that we have. On data, we have engaged with our trusted data partners like Clarivate, working with them to look at data in a different way, to acquire new data, to fill our gaps in understanding, and to pursue better outcomes for patients. And so now I think I have to say that Clarivate has been a standout in terms of their customer focus and I would say obsession to get us to a stage where, we truly have a lot of data that we can now drive insights with. And on the capability and people side, I'll leave it to Freddie.
Yeah, adding to Rachel's point, I mean, we have invested a lot in this foundational preparations, just a data collection, and all this work have been carried out in Janssen for the last few years. And from a talent perspective, we are also trying to build a data science team and build an analytics team and really trying to leverage this data to generate the insights. And we are also working with a lot of the third-party partners that really provides a lot of capability extension for us. So all this together, I think we are doing a lot to really build this organization into a data-driven organization and trying to understand the disease better and really better serve our patients.
So Tom, we heard an obsession with data. So equally, where do you see yourself fitting into the ecosystem, and what's been your obsession in the last 5 years?
And our obsession sort of really stems from empowering our customers to deliver a healthier tomorrow. That's our job, is to help companies like Janssen to create better outcomes for patients. And I think that's the bit that we have to get right from our side of the desk, if you like, Anna, is making sure we are partnering with our customers. And I think that combined with technology, and we've spent a lot of time talking to some of our colleagues at KPMG around technology, and it's been great for us. But that's the other piece that's really key: the data integration combined with the technology, and then layering in expertise, whether that's disease area knowledge from a bladder cancer perspective, for example, market access point of view, or regulatory compliance point of view. That expertise combined with technology and that ability to integrate and master that data is where we believe you get contextual intelligence, and where we can drive faster, better decision making alongside and with our.
On that note of obsession with data, outside, Janssen and Clarivate, what have you seen that's been truly innovative, that's made you go, wow, versus potentially just shifting the dial in terms of leveraging data?
So I think and again, I'm a mere novice, and Freddie will do a much better job. But I think AI and ML have played a huge amount of a role in probably more from a drug discovery perspective in the last sort of 10 years or so, 10, 15 years. And you're seeing significant advances in terms of being able to, let's say, utilize all the data that's available to advance different ways of taking a drug through development and prior to going into human. And I think that AI usage of AI technology in drug discovery has been incredible. There's companies now using AI to instead, and using sort of human models and human data to, instead of using animal models for their preclinical work. And for me, that's a number of different perspectives that shows huge innovation in terms of what, not just having the data, but using technology to create value from that data can bring. I think that's really, really exciting. You're also seeing, I think, the use of AI, ML, machine learning will also drive significant cost benefits. And you're seeing that in many industries. So I think there's a huge amount of great things happening. And within our industry, I don't think we have to look very far beyond our industry for inspiration. And I think it's now just making sure that, again, there's a collaboration and partnerships with companies like Janssen, KPMG, and Clarivate working together to really make the most of the technology we have in front of us now.
Well, I think that's going to be interesting to elaborate on. And, I'd love to hear, beyond that, Freddie, perhaps expanding on what Tom said, where are you really seeing true innovation leveraging data now, expanding on what Tom's just shared?
Yeah, I think definitely it's going to be the data and the technology. I mean, the AI technology is just developing so fast. I mean, last year, there's no ChatGPT, and suddenly there's a ChatGPT appears, and people are starting to explore, what this can bring to us, in terms of delivering all the changes. So what I see the opportunities there, in terms of this generative AI, this large language model is going to be, we already see a lot of this kind of, applications that is being applied in other industries and revolutionizing a lot of areas. But in healthcare, I see that is coming very soon. So the potential is huge, especially we give that healthcare got a lot of this data, this free text data, the unstructured data. So it will accelerate the whole insights generation, and also consider how fast the technology evolves. I believe it will be reshaping the healthcare industry in many ways in the near future.
I think Freddie and Tom covered it, right? But it's, really, if we can use these emerging tools for additional insights, efficiencies, better patient and customer engagement, better drug development, the possibility is really endless if we leverage these properly and responsibly. It is AI, it is tricky, but I do look forward to the day where in healthcare that we can integrate these tools into our daily decision making, right? Allowing me to, more time to dream up even better solutions for patients to improve outcome.
You've already kind of helped segue us into what's the future of leveraging data at the moment. I'd love to hear your perspectives, based on the acceleration of leveraging data, new technologies such as AI, now moving from more emerging to mature technologies. Where do you see, Rachel, Freddie, and Tom, the next 5 to 10 years in terms of real innovation for leveraging data?
Sure. I think I would see in the next few years, I would see us really addressing the data paucity issues that we have, especially in Asia Pacific, right? We're collecting vast amount of data. We should be able to fill that gap and address patient needs. And also the ability to really connect and make sense of these data that we're collecting. I also look forward to making things real time so we can, test, learn faster, And I think with the tools emerging, we're on our way to achieve these. And I also have to mention precision medicine, right? And tailored, more personalized patient diagnosis and treatment. And Freddie has a great example to share as well.
Yeah, thanks, Rachel. One of the examples, like the Janssen study of, Alzheimer's disease. So, the study on using the speech biomarkers to detect this early sign of Alzheimer's disease. This is excellent, actually, demonstration of how this emergent, like non-traditional, unstructured, this data can help it understand about the deeper about the disease. So I think in the future, right? So not only the speech data, but just imagine this image data, even the 3D scanning of your body, your brain, and this tremendous amount of data that is being generated, all this non-traditional type of data that can be really used to broaden our understanding of the disease. So I think this will result in explosion of these data sources. All this digital health company are generating, and this will help us to drive a deeper scientific understanding of all this disease and better serve the patient.
So Tom, if you look into your crystal ball, does the next 5 to 10 years look like Freddie's and Rachel's?
Yeah, I think they've covered the question exceptionally well. And I think this is the exciting thing. I think, again, going back to why we're here, it's all about improving outcomes for patients. And if we can do that quicker through adopting technology in certain areas, then that's only going to be a positive for society. I think there's going to have to be like AI drug discovery, the firms that there's going to have to be pulled through in terms of successful clinical candidates coming through. But again, that's only inevitable. I think it's only a matter of time before we see that. I think also you're going to get a case where all of us as people are going to be more informed around our healthcare, around the options that we have. And that can only help us participate in our care journey and take ownership of our care journey instead of sort of relying on doctors' orders in terms of what we're supposed to be doing. I think that's going to be great. And I think Rachel touched on a really important piece, which is precision medicine. I think if we can do a better job of targeting the patients that we know will have the best outcomes based on the treatment or device that we administer, then I think that's huge. And again, I think that will allow us also to be as efficient as we possibly can in our healthcare systems, which is obviously also a critical element of what we try to manage on a day-to-day basis. It's really, really important that we're starting to see the impacts of the work that's being done in some of these areas, such as Alzheimer's.
Thanks, Tom. And I think it's really exciting to hear that through data, patients now have a seat at the table, and they're empowered and they're almost expecting to be treated as an individual. I'm interested to take this conversation to the next step, because it's great to have a crystal ball and get excited about the next 5 to 10 years of innovation. What do you see, perhaps starting with yourself, Freddie, some of those key enablers to achieving that future vision? What does Janssen, Clarivate, other companies need to start doing now to actually achieve those big ambitions?
Yeah, I think that digital and data literacy, so among the people working in this ecosystem, is really crucial. So the healthcare industry is highly complex, so it requires a lot of deep domain knowledge. So I just foresee that a breakthrough won't be coming from a single point of innovation, but instead it rather requires the transformation of all the major process, like from the payer side, from the healthcare provider side to the pharma side. So this actually requires the improvement of digital and data literacy of this people working in this whole ecosystem, like just hiring a few more top AI scientists. I don't think that will work, right? So they would just feel bored and they would leave. But what we're really transforming the whole industry is really changing the mindset of people working in this ecosystem.
Yeah, so I would say whether it's enablers or obstacles, challenges we need to overcome, right? Data privacy concerns, ethics, how do we use it properly? Regulations and laws need to keep up with these rapid changes. right? We need more much more flexibility to allow us to experiment. And the data consistency and linkage challenges that I talked about, that will need to be enabled, right? We need to link, we need to connect the data in a meaningful way to drive insights for better outcome. And with more data, maybe one day we do achieve more health equity, right? So I think that's the dream, if we overcome all these challenges and we have the enablers in place.
And Tom, what about from your perspective?
Yeah, look, I think the key thing for me, and whilst COVID obviously was a very, very difficult time for many, many people, it did foster a lot of partnership and collaboration across the healthcare industry, ecosystem, shall we say. And I think we've got to sort of take that and continue with that to make the most of this. I think both Freddie and Rachel definitely talked about data paucity in certain areas. Like US has a huge data asset, if you like, within that geography. In Europe and Asia Pac, it's a little bit more fragmented and there's data paucity. So I think also collaboration. In Europe, there's the European Health Data Space Initiative, which is sort of trying to get the most out of the healthcare data available in Europe. I think these sorts of initiatives are really, really important. The collaboration, bringing together like-minded people to make the most and to have that mission to improve health, but working together with the data available, I think is critical. And then I think collaboration, a bit like we've seen with KPMG and Janssen, I think, for us is a very different model. And I think we have to embrace that. We have to work together to take on some of these challenges and make the most of the opportunity that we have in terms of embracing the technology.
Thanks, Tom. And I think it's really interesting how the discussion's evolved, where it's really become about the individual patient, but actually as an ecosystem, it's become about the collective and the collaboration and the joint partnerships to enable that individualization of the patient. So, but before we kind of bring this to a close, I'd love to get your perspectives on, for those in the room or watching this, is there any advice for other organizations or ecosystems players looking to leverage data? What can they do? How can they start? What's the potential call to action from this discussion?
Oh, I think it's definitely continuing the theme, right? Willingness to partner, willingness to share and collaborate. We all hold data, but without sharing, we cannot link it, we cannot drive consistent, holistic insights, right? At Janssen, we're trying to look at disease burden in a more holistic way, right? It's all about getting the end-to-end insight. So be prepared to share, be willing to collaborate. We've established a very good partnership between KPMG and Clarivate and Janssen, right? I think that's the model that we'll be looking forward to drive more insights, and others should do the same as well.
Freddie, what would you kind of call to action from those on the line, adding to what Rachel's just shared?
It's really to start to hire more the digital talent. The organizations increase the digital literacy, data literacy of the organizations. It's definitely going to be a journey that requires a lot of effort, but then where's the investment? So when the disruption moment comes, so that's where we can lead a game that organizations with those capabilities can really drive the changes.
Thanks, Freddie. And so we've heard, digital literacy, partnership. Tom, what's your advice for those on the line?
So I think it's the people piece. I think both Freddie's looked at it from a talent perspective. I think Rachel mentioned it more from working together and collaborating. I think one of the key things that we see is breaking down internal silos is really, really important. There is data existing and available in different parts of our customers' organizations. And I think sometimes it's making sure that we break down those silos. We understand there's utilization and democratize that data to have use in other areas. But I think if we can make a call to action to really try and make sure that we are, let's say, not necessarily breaking down silos, but we are collaborating and sharing data and being open with the data we have within our organizations. I think that's going to go a long way to ensure that we are driving as much value as we possibly can from all the data assets we have at our disposal.
Thanks, Tom. And I love the way this conversation's evolved, where we started with data, but we actually ended with people, in terms of it's all about the capability and the literacy, all about the partnerships in the ecosystem, all about collaboration and democratization and breaking down boundaries. So really, as a collective, we can focus on the individual patient, or more importantly, as we've discussed, the person or the people. So thank you so much, Rachel, Tom, Freddie, for your time. I think it's been really insightful and inspiring. And hopefully for those on the line, you've learned a little bit more about how you can leverage data as an asset.
Shifting from data to customer and employee digital transformation, we are delighted to have with us today Hank Yang, Managing Director, Healthcare and Life Sciences, and Roni Kopelman, Managing Director of Human Capital Advisory at KPMG. Both colleagues are from our offices in the US to share some invaluable insights on creating a world-class human experience.
Hi, it's Hank Yang, Managing Director at KPMG. I lead our Salesforce capability for healthcare and life sciences, as well as helping to support our clients in really understanding how to drive differentiated experiences through digital technologies.
Hey, this is Roni Kopelman. I'm a Managing Director in our Human Capital Advisory practice. I lead our workforce experience offering, which means I get to work with lots of clients to help them set their strategy around how to create a better workforce experience.
Really, a lot of the thinking that Roni and I have really focused on is around really connecting the customer and an employee side of things as really a connected overall experience is an important part of how we've thought about really supporting our clients. Roni?
Yeah, one of the things that's really central to all of this, both on the kind of designing for the customer and also designing for kind of the workforce and the employee as well, is this concept of design, build, and operate differently. And central to all of this is making sure that you're taking this human-centered design approach and putting it at the center of what you're doing. And what I mean very specifically is, rather, when you think about this on the employee side and kind of on the HR solutions, rather than just designing kind of like an HR for HR solution, but you're really taking the lens of, let's design something specifically for the employee population. And that means designing solutions where they're actually part of co-creating that solution. It's about an entire experience. I always use the example of when somebody moves, right? And traditionally, we would design a process to make sure that you can capture somebody's new address, for example, but you don't just have a new address, right? You move, and along with the move, you've got all of these other things and events that have to be strung together to make sure that that's a good experience. You might be eligible for new benefits. There may be a payroll impacting event. Maybe you have a new commuting benefit that you're eligible for. So these are all different things that need to come together, and they traverse the organization. So you really need to design differently, and then you need to build differently as well, right? So in order to get those connected experiences across the enterprise, you need to maintain that connection and build solutions that are traversing the organization. And with the advances in the technologies that are out there, we can really do that as well. And then finally, if you're going to have sustainable solutions, you need to build a new muscle. You need to operate differently, and you need to think about, how are you going to govern across these different platforms and these different functions in the back office, and potentially even crossing over to the front as well, because it's a different problem that you're solving for, where it's really these connected experiences, and you need to maintain that you need to make sure you've got the right governance in place so that you've got something scalable and you can grow with. Traditionally, we've thought about digital transformation. It's really easy to think about it in the lens of something like process efficiency and effectiveness. And if we were to look at how things evolved over the past 10 years or so, that's very much what it was about. It would be about things like cost takeout or service delivery models. But what we've learned over the past few years is that the critical unlock to the value is actually this third leg of the stool. And it's the experience lens here. And so making sure that we're really thinking about this with all of those elements that I talked about previously, by putting the employees or the customers in some cases front and center. And the way that we think about this is starting with a really structured approach so that you could measure and you can track value on an ongoing basis. I think Hank would probably agree there's very few organizations that are willing to invest right now when you don't have a baseline understanding of where you are today, and then you can establish something that you could measure value with going forward as well. The other major thing that I'd hit on here, just in terms of what the workforce has become accustomed to in general, right? Everybody is expecting something a little bit different out of what they're getting from their employers, right? And so in order to do that, we need to deliver value quicker. We need to be agile. Everybody's accustomed to change right now, and it needs to change the way that organizations are actually thinking about delivering this. Workforce experience is not just about delivering better technology, for instance. The organizations that are thinking about this, so if you deliver the right experiences to your workforce, you're going to be able to create an advantage in the marketplace because you're going to be able to attract, retain, and grow top talent. And this is so important in the marketplace today because you see some of the jobs reports coming out, unemployment historically low in the US right now. Capturing that talent and developing it is a business imperative right now. It's not just an HR imperative. And then we see what's going on in terms of what those future skills are actually going to be. And they don't necessarily even exist in the marketplace. You can't even go acquire it or buy it. So you have to be thinking about how you're developing that in-house. And so that first pillar there is so important because your future leaders are probably in your organization today, and you need to be able to identify them and then grow and develop them for the future. The next is unlocking that talent potential, kind of connected to that first one, but making sure that everybody that you've got there has the tools that they need to be effective, and that we're actually maximizing the use of some of the technologies that are out there that could nudge people along with their new career pathways and the learning and certifications that make sense for them to acquire to take that next step in their career. From a productivity standpoint, again, we have to make sure that everybody's got the right tools and technologies in place to be productive. I think the pandemic really shined a light on this as modes of working changed, right? And everybody was home for a period of time, or at least moved to some sort of hybrid model in most industries that were out there. And this productivity piece really came to the forefront. And it was about making sure that people knew where to go. And you really saw in the market a lot of organizations say, we've actually pushed too much out. We need to simplify, and we need to give people one place to go to consume information or collaborate. And lastly, from an HR perspective, digitizing the HR function, automation is still going to provide some level of efficiency and effectiveness. And there's so many tools out there, and the next generation wants to self-serve in many cases, right? And making sure that we're delivering these tools and access to information and service or get help or connecting to the organization in a way that's digital is expected from the workforce today.
There's a lot of talk right today around artificial generative intelligence, as well as different ways of using it, from Copilot, where you're really assisting employees to drive a greater level of insight into what they're actually developing or working on, from the types of different roles or areas that they may be focused on, to how are you actually kind of changing the experience for the end customer or consumers that you're dealing with. The access to information is continuing to evolve and change. And that's no different as it is from other sectors that it is from life sciences. I think the specific focus for what we're seeing at life sciences is really driving that consumer grade experience, understanding some of these personalized therapies where these advancements in biopharma and some of these other areas within the pharmacy industry are really leading to an impact in terms of understanding how do we actually personalize that experience and understand some of the pitfalls and really the supply and demand challenges that you have with delivering care. And then really getting the right ecosystem of care coordinators, nurses, physicians, as well as some of the supporting social workers and others that need to be involved to really healthcare experience accomplished. In order to enable these patient experience, these consumer experiences for the supporting customers in these healthcare organizations for life sciences companies, that tie-in is going to be critical to it, and using as much information and data that they've already gathered over the last 5-10 years to drive forward into how they can transform that experience going forward is important as well.
Yeah, what's interesting about this evolution, Hank, that I see is that much of this actually started on kind of like the customer facing, where I think customer solutions were a little bit ahead of thinking about the workforce, but the themes are the same when we look at it, right? In terms of data and AI, and actually what's the impact of the workforce in terms of that generative AI, right? And what we see going on right now, and how's that going to change what the workforce looks like and the skills that are out there, the personalization piece of it. When you think about what you experience in the consumer in the consumer marketplace, right? And then what workers are now expecting and what the technology can actually do and the types of data that we can access on the workforce side. Well, so I think, just looking back historically at the trend, and customer facing solutions probably a couple of years ahead, but same themes. And I think the pandemic really just accelerated the need for all of this based on what we've seen just in the market and what the workforce is expecting. And then the data proves it out as well. When we do our surveys every year, we're hearing different things than we were 10 years ago, right? Where 10 years ago, we're truly about, I'm just interested in, my compensation, right? But now people are making decisions around work-life flexibility, right? Or talent development and their ability to actually grow in their career. So really interesting trend, but it's nice to see them sort of come together in a common set of themes here.
Yeah. And just to kind of build on that, we are at a very critical point in where we are as a society and as a kind of overall experience in terms of what's changing. And I think there's an opportunity for really our organization as KPMG to be a part and be the leaders and drivers to support our clients in driving that change. So I think, Ryan and I personally have worked with a client that I think has really started to kind of take hold of that change and start to drive it forward, involve them. I think what we're starting to see in many of these areas is that they are continuing to evolve in a way where technology is continuing to be a core part of changing experience and moving towards digital. And really that layer of consumer and employee and customer side of things is a critical part of where those changes are taking place. So many of the kind of back-end systems that Roni was talking about earlier, I think are modernizing, as well as the need to really change how employees and customers really interact with them. And within all of these segments, as well as I think beyond these areas as well, it's an evolving area.
I think we started the conversation around making sure that we're putting your customer, whether that be a consumer, a patient, an employee, at the center of your design, right? And we're going to kind of close off with that same theme here, just to finish it off. And the way that we think about this is a framework that starts with really identifying the experiences that matter most. And this framework, by the way, scales across whatever function or solution you're talking about, if it's a patient-based solution or if it's an employee-based solution, to understand what does that experience or journey really look like. Take the lens of the person that's going through it. In this case, it's an HR lens, right? So you're looking at from a manager, employee, a new hire, an executive, and these people experience these moments or these journeys in unique ways, and they're expecting that you're personalizing it. How are you going to govern that over time, right? How do you make sure that you've got the right programs in place so that you can make it better, you have continuous improvement, and you've got a solution that you can actually scale and sustain going forward?
Yeah. Totally. And whether you'll see a few tools like listed in here in terms of the technologies, but Salesforce, as well as a number of others that are Microsoft and a number of others that are in market too, are continuing to be a part of some of the changes that are happening in the industry. And I think a lot of this is really helping our clients understand how to stitch many of these pieces together. And redefining how they're actually going to drive differentiation in their organization. So I think a really exciting time for us overall in terms of where things are going, and a lot of opportunity and potential for really doing something different, and I think for the betterment of everyone. So
thanks, everyone.
Our next guest speakers will take us from the real world to the metaverse. I am delighted to announce our next guest speakers, Professor Shafi Ahmed, Chief Medical Officer of Medical Realities, and Justin Haas, Technology Leader for Life Sciences in KPMG US.
Professor Shafi and Justin will be taking us to Avalon, the world's first healthcare metaverse. I don't know about you, Anna-Marie, but I'm very excited to hear about it and looking out for my own avatar.
Hi, I'm Justin Haas, a Global Lead Partner for KPMG and one of our global technology leaders. Today, we're talking about a polarizing subject, the metaverse. As the healthcare ecosystem rapidly changes and we continue to look to additional ways for better patient access, the metaverse appears to be one of those innovations that could change how we access healthcare. Today, I have the pleasure of having Professor Shafi Ahmed, who is a multi-award-winning cancer surgeon, teacher, futurist, innovator, and entrepreneur. He is currently the Chief Medical Metaverse Officer for Ahmed, who is building the Avalon, the world's first healthcare metaverse. It's a pleasure to be here today, Professor.
Thank you so much for the kind introduction, and good to be here too.
Great. Maybe we can just start with a broad topic around your own personal mission and values, and maybe you can share a little bit about how you're leveraging your experience and your passion to delivering better healthcare outcomes for all.
I'm a surgeon based in London, and in fact, this July will be my 30th year in clinical practice. So it's got a long time to be in clinical medicine. My main interest of all these 30 years have been cancer care, to improve access to patients who have colorectal cancer. I'm a laparoscopic keyhole surgeon. So I spend a lot of my time looking at patients with cancer disease, terminal disease, and of course requiring treatment from surgery and palliation. I've also spent the last decade working innovation and teaching primarily as the Associate Dean of the Barts Medical School for a number of years. I thought about what new ways can we teach global audiences in terms of medicine, surgery, and digital transformation. So I've toyed around with technology using Google Glass or virtual reality or avatars to see how we can expand our horizons and teach and scale the teaching so that more people can benefit.
So maybe you could start off with a broad definition of, your view of what a health metaverse is, because, a lot of people debate what the metaverse is and isn't. It's very polarizing. Is it just a toy, or can it be used for life-saving surgeries? But maybe you can give your perspective on what you believe the health metaverse is.
Sure. It's a very interesting question. First of all, the metaverse, let's take that part of it. And it's not just a VR experience. It's much more than just having virtual reality and being in a virtual world. It means a total digital economy. What does that mean? Let's talk about the building blocks, what a metaverse might be. And I kind of use the terminology of like the 5 pillars to build a metaverse. The first one is building a virtual world so that we can interact with, for example. The second is creating replicas of yourself as an avatar or a metahuman that's maybe more lifelike. We then create the standards of how we may create a system of healthcare within this kind of virtual environment. There's a whole question around the data part of it, the NFTs, the technologies that underpin this new world that we kind of will create. And then creating the experiences or therapies in healthcare that might support patient care or improve education. So I think it's a number of technologies that will kind of come together to be able to access these virtual experiences. And so let's go back to 1 second. I talked about John Radoff, who talks about the 7 layers of the metaverse, which I think is a really interesting way of looking at it. Yeah. Talk about the kind of the infrastructure it's built upon with its 5G, connected health, the computing power, the GPUs, for example, to give you the mechanism of delivery. Then you've got the human interface, how to interact with that kind of virtual environment, a decentralized platform as opposed to a centralized platform, using spatial computing to be able to see this 3D kind of internet that we describe as the metaverse, the economy that's created by the creators and experiences from there on. And then it's all entwined into the experiences of the end user. So it's much more elaborate than just what people might perceive as just a virtual experience. And healthcare itself is interesting. It's how to create a health environment where you can educate patients, empower patients, or teach medical students or professionals. And how do you deliver therapies, treatment? How do you consult in that environment? And that's kind of what we're creating at EIML, is trying to understand where it'll have impact and the use cases from building such a metaverse.
So obviously one of the, I guess, critical factors of having a successful metaverse, and then if you layer on, having a health metaverse, right, is interoperability around data sharing, right? And obviously, many countries, have different standards around privacy and obviously having access to that data around patient care and therapies. So what do you see as some of the kind of crucial aspects of data from an interoperability standpoint? And maybe I'm taking one layer deeper is, do you see any kind of privacy concerns initially when we're trying to think about a health metaverse?
That's a great question. So data has always been very difficult in healthcare, about ownership, about protection, ensuring that we're secure as possible. We struggle with that in the real world, let alone in a virtual world. However, I think if you think about data in itself and look at the way the metaverse has been built on Web 3.0, which essentially is a decentralized platform. That's the key part of it. At the moment, data is stored, as we share on the internet widely, on social media, in a centralized platform. We have no ownership, therefore we have no control. And therefore, actually, the monetization that happens from it is out of our control. But yet we share data openly to various companies on that format. So Web3 is crucial. It might change that conversation about having patients who will own their data and could even, go forward, perhaps monetize it. Then, of course, if you use blockchain technology, I'll talk a lot about these different technologies coming together. Blockchain is far more secure. Therefore, if you have a data that's based on blockchain, then creating NFTs or non-fungible tokens around that, that becomes a source that's much more powerful, that's much more secure than it is at present. Therefore, maybe a different paradigm shift of saying how would data be captured, etc. And we're working with a number of companies using data, sharing data, and understanding what that might mean. The other thing that I think that Web3 allows us to do is build in the regulations at the beginning. With Web 2, where we're at the moment, it's kind of it's been a kind of the Wild West, if you like, because we've let it go out of control almost. Trying to rein it back is quite difficult. For example, in the metaverse or this virtual that we're creating, there are agencies like the XRSI. It's the XR Safety Initiative, run by a group from the US. There's the World Metaverse Council, all building standards around HIPAA compliance, around FHIR, in terms of interoperability, in terms of patient confidentiality, data ownership. So we're building that at the beginning to make it as safe as possible, which is what I like. I think as we build it, if we understand the limitations of conventional internet or what we do with data, actually perhaps we overcome some issues and create a much more safe environment. So as we create our own kind of metaverse in healthcare, and we're the very first to create it, we're trying to work with agencies so that we protect patients' data at all costs, but also have an open conversation about how that could be used going forward in the future.
So one of the interesting things you brought up was around privacy and ownership of data, right? Today, with social media, as we give away data crumbs, easily, right? Through Facebook and other social media tools. But one of the things that I thought was interesting in your conversation there was around ownership, and you through an NFT and blockchain having ownership of your own healthcare data, which we don't have today, right? And they're stored in monolithic systems, and they're difficult to access, right? So as we become more aware and have ownership of our own data, how do you think that impacts the success or potentially failure of a health metaverse from your perspective?
Yeah, I think let's look at conventional medicine at the moment. Let's talk about data. So it's always a contentious issue, understanding the ownership of data in the current system and how patients can interact with that or even own it. And it's a discussion that we kind of struggle to have with our patients and stakeholders. If we said to patients, for example, first question, would you share your data openly for the greater benefit of society? I think virtually all patients say yes, of course. If it's helping other patients, other people to improve their health, of course, share my data. If you then ask the question, okay, as a patient, would you be happy to monetize that and make money out of it or get something in return? That suddenly becomes a difficult question to ask because as a society, we're not ready for that conversation. So I think as we go forward, we have those intimate conversations about choice. So I think that's a conversation that society needs to have at all levels, as government, local level, with companies like us, for example, and standards agency to understand what that might mean for patients. Ultimately, what we're here for is to empower patients. If we look at the world of personalized medicine or precision medicine, which is what we aspire to, where digital health is helping us innovate, actually, we should be doing much more than that and letting patients empower themselves with their own data, ensuring they have better outcomes that's more personalized. So I think some multitude of conversations need to be had that will help us understand and overcome some of the barriers that we face ourselves around this problem of data and ownership.
That's great. One of the things that you mentioned earlier was, talking about your human avatar or your metahuman, as you called it, and you start thinking about this broader health ecosystem using Metaverse and other technologies and interoperability around data and potentially data monetization. But how do you effectively consult with your patients in a Metaverse environment? Like, and maybe secondly, obviously, kind of a provider kind of environment, but do you see a role for life sciences, pharma, biotech companies to play a critical role within the Metaverse?
So I'll give you a couple of examples of what we're doing to build the Metaverse for life sciences. So we're working with a number of very large, well-known pharma companies whose names I can't share, of course, due to NDAs, but we're creating their solutions for the Metaverse in pharma. Let's take that example. For example, we're creating virtual environments to conduct clinical trials for recruitment, for assessment, and for follow-up, doing that remotely within this Metaverse environment. And we're also allowing them for distribution access to healthcare individuals who can meet in this forum rather than going to hospitals, which is expensive, time-consuming, and inefficient use of people's time. We're creating this environment where we can talk about drug therapies, the outcomes, showing 3D models of how the interaction could happen into a kidney, into a heart, for example. We're also looking at, for example, medication and therapies and what that might mean for the patients and for patient engagement and empowerment to improve efficacy and outcomes. And the last bit is about training and education. So there's a number of areas where I think this will be of huge value. And back to the question about clinical consultations. In fact, last year we did the very world's first proper clinical consultation in the Metaverse. It was a patient with unstable angina in a hospital in Lausanne Hospital. They are part of our group and part of our collaboration, who conducted a remote collaboration. And the outcome was we published that in a peer-reviewed journal. And so now we're working on how do we improve the access. Look, healthcare Metaverse is not for everybody. It's not there's not a kind of, it's one part of an array of possibilities. It's not one size fits all. The question of how we go forward is where does that Metaverse offer better outcomes, improve experiences?
Yeah, you bring up an interesting point. One of the things that in my last 15 years of being in the healthcare and life sciences is, and experiencing, through family members who've had health difficulties is like, we have to have multiple front doors to your healthcare, right? And one of the front doors to your healthcare could be this digital experience, right? Beyond telehealth, right? Telehealth, I think, is great and has its purpose, but for other organizations within the healthcare ecosystem, the value chain of healthcare, right? The big H, right? With life sciences firms and medical device firms and your provider and specialists that might be sitting across the globe, all coming into a digital environment to collaborate around your healthcare is super exciting. If you can see into the future and be a little bit of a soothsayer, what does it look like in 5 years? And as we, have more access to this technology, the technology becomes more ubiquitous, and we're really focusing not only on just traditional healthcare measures going into provider settings, but also have these digital front doors.
That's a great question. I remember saying, of course, we're very good at predicting the next 2 years, but very poor at predicting 5, 10 years. So, but I'll give it a go, Justin, now that you asked me that question, of course. I couldn't obviously answer that question without mentioning ChatGPT-4 and AI. So I've got it out there already at the beginning. Okay. So look, the world is changing rapidly. AI is going to be huge compared to what we do, powering our health system, powering our conversation. And of course, that's a really interesting and exciting future, but also worrying for a lot of people about what that might mean for us. The world we live in, we're going to robots, AI, ChatGPT-4, text to voice, avatars, holograms. What it means to me is that it offers a flexibility of access, which you mentioned earlier, I think. And if you look at the young population, say, for example, between the ages of, 10 to 20, for example, Roblox, Fortnite are so popular amongst the gaming community. Mm-hmm. Hundreds of millions of people every day on those platforms. If you push forward 10 years, these same individuals who now are digital literate and they actually use those platforms will be the first main users, I think, of these new technologies and metaverse. However, it's also going to impact all of our lives, the way we connect with technology, the way we interact with our doctors, for example. Already we're using chatbots as a triage tool for the first point of contact in primary care. They'll only improve with a different way of interacting, maybe an avatar, with a kind of chat GPT interface that's a text to voice, for example. And already in our AI Medis, we've produced a way of you communicating with your avatar. And I have a virtual assistant called Ava, who's my AI assistant in the metaverse, who then communicates with me through chat GPT, through voice, and she answers directly to me. And we have a conversation, for example. Already we've built that into our platform. So this is not 2 or 5 years down the line. This is real today. So I think it's impossible to reimagine what's going to happen in 5 years. But I think we'll offer patients alternatives to conventional medicine, access to medical support. And we'll see a convergence of these technologies that'll make it much more efficient going forward. There's always going to be barriers, of course. There's a digital divide, elderly patients who may not feel comfortable, for example, in this environment. So we have to be very careful about how we roll this out, who it's applicable to, and make the access easier for a lot of people if we're going to get take-up. But most importantly, is showcasing the therapies or the treatments or the education that's validated and will improve experiences or improve outcomes by either clinical trials or showing some kind of response through questionnaires and things. And in 5 years' time, of course, Justin, I won't be here. It'll be my avatar, my hologram, be speaking to. We'll be together in some virtual world, having the same conversation. So that's what I look forward to.
And we look forward to maybe speaking to you in the future, maybe through an avatar in a healthcare setting.
I look forward to it, Justin. Thank you so much for the kind invitation. Thanks again.
What a fantastic way to end the first session of today's event. If you have any key thoughts or takeaways from this session that you'd like to share, please feel free to drop them in the post-event survey.
I don't know for you, I'm personally excited about the metaverse and the opportunities it brings to help our clients solve some of their unique challenges. Please do remain logged in for the duration of today's program in order to secure your CPE credits. At any point, please feel free to share your questions through the Q&A panel. And also, if needed, do reach out to our technical staff if any issues